Alright, in this video we'll be discussing the difference between local contraindication and systemic contraindication. Let's go ahead and dive into this material. First, let's make sure we understand what a contraindication is. A contraindication is any reason that suggests a client is not a good candidate for massage therapy services. In other words, there are red flags, as I like to call them, that are going up as we perhaps are reviewing their initial consultation that suggests that it's probably not the best time for the individual to receive massage therapy services. Now, let's differentiate between the local contraindication and a systemic contraindication. A local contraindication is any reason to avoid a certain area of the body during a massage. This area of the body is locally contraindicated. For instance, let's say that a client arrives at the beginning of the week for their weekly appointment and you notice that the client has an adhesive bandage over their hand. After reviewing their goals for the massage therapy treatment, you inquire about the bandage over their hand. The client mentions that they were cooking over the weekend, and as they were removing the food from the stove, they accidentally forgot to put their kitchen glove on and burned their hand. Now the client assures you that it was a minor injury, but that it really hurt. You let the client know that you will avoid this area for the massage treatment. Now, because the client's injury is bandaged up and under control, it would not be wise to postpone the massage, since the client has already treated the minor injury. However, since the injury is likely still healing, it would also not be wise to directly massage the hand or the fingers. So this area of the body would be locally contraindicated, meaning you may massage the rest of the body, but avoid the hand until it has properly healed. Now, a systemic contraindication is any reason to avoid the entire body. Think of the word systemic here, meaning the entire system. The entire body is systemically contraindicated. I've also heard this type of contraindication called a general contraindication. Make sure you know it by this term as well. The MBLEx may use these words interchangeably, so make sure you know general contraindication also is a systemic contraindication. Now, for instance, let's say that a prospect client arrives for their initial consultation. They booked online, so you were not able to speak with them on the phone prior to meeting you in person. As you go over the intake form, you notice that the client checks off blood condition, and underneath other writes the acronym DVT. You inquire about the acronym DVT, and the prospect client informs you that they were diagnosed with deep vein thrombosis when they had a terrible ache in their right leg and went to the emergency room a week ago. The prospect client wants to see if massage therapy would be able to help with the pain. The ache is oftentimes unbearable. As you are speaking with the client, you assess the client's leg and notice that the right leg is larger than the left, red, and inflamed. Now, because the client has a confirmed diagnosis of deep vein thrombosis, the right leg has edema and is red and inflamed. To massage the client would do more harm than good because the client's blood flow in their right leg is inhibited, meaning that there is a confirmed blood clot that is blocking the blood flow from returning to the heart. Now, if you're wondering why it wouldn't be okay to massage the rest of the body since it's just the leg, I would argue that because we know that the client has a confirmed case of DVT, we should have an understanding that systemically, the client has poor circulation, inflammation, and an excess of fluid in this leg. Massaging the rest of the body may further exacerbate this condition and the body's ability to adapt to the massage therapy services. Because we know there is a confirmed blood clot, if this clot is loosened by the massage, there is an increased risk for an MBLEx, a traveling clot, which then can become fatal. Again, to massage the prospect client would do more harm than good. The prospect client is systemically contraindicated. Now, real quick, I want to make a note of something here. I've often had a student or two ask me, why do we have to do all of this work just to massage? And by work, they mean the program, bookwork, homework, test, MBLEx, etc. Well, the answer is very simple. Public safety. Could you imagine someone who does not have the education or understanding of how harmful or even fatal it could be to massage someone with a blood condition like this gentleman? I believe, therefore, it is fundamental that we know when to and when not to massage someone, or even when to refer a client to another practitioner who can help them when it is outside of our scope of practice. For instance, if this client didn't have a confirmed blood clot and we notice that the right leg is red and inflamed, and the client has a deep ache, we should be able to understand that it is not safe for them to receive a massage, and they should seek medical attention right away. Make sure you understand that a local contraindication is a contraindication that locally contraindicates a certain area of the body, but the rest of the body can be massaged. And a systemic contraindication is a contraindication that systemically contraindicates the entire body for any massage therapy services. Now, let's see if you're able to discern whether or not the following examples are local contraindications or systemic contraindications for massage therapy services. So the very first one, a client comes in with a saran wrapped forearm. The client tells you that their tattoo artist just finished touching up some small areas of their tattoo. Would this be considered a local or a systemic contraindication? So if you said a local contraindication, you're correct. The rest of the body is safe to massage. Just as long as the tattoo is properly covered up and the client is able to safely receive massage, they should be perfectly fine. So just avoid the saran wrapped arm, but massage on the rest of the body is safe. Next example, a client comes in for their monthly massage session. They canceled last month because they were not feeling well enough to make it in for a massage. After speaking with the client, they tell you that they still feel fatigued and their legs are still swollen. After you assess the client's lower extremities, you notice that they are in fact swollen. And with the permission of the client, you ask if you can assess their legs for pitting edema. The client agrees. You press firmly with your thumb for at least 2 seconds and notice that after the application, your thumb's indentation remained on the client's leg. Would this be considered a local or a systemic contraindication? So if you said a local contraindication and just light pressure, this one is a really tough one. We need to know more information before we can determine whether this client is a good candidate for massage therapy services. We need to ask if they've been to a doctor, if they've received a diagnosis for this condition. If it's a female client, are they pregnant? Is it painful? There are numerous causes that could be contributing to the edema in the client's lower extremities. For instance, heart failure, inadequate blood supply, protein imbalance, pressure in the veins from immobility, etc. For the time being, I would argue that this case is systemically contraindicated, at least until we know more the reason for this condition. What we do know now is the client has an excess of fluid in the body tissues, likely has poor circulation, and massaging the body may further exacerbate these conditions and the body's ability to adapt to the massage therapy services. I would encourage the client to seek a proper medical diagnosis before we can do the massage. And then the last one. A client comes to you with a referral from their orthopedic surgeon a week after surgery. The client had their knee replaced. The surgeon wants you to avoid the knee and the incision on the knee for the first 6 weeks. However, the surgeon would recommend massaging the tissues around the knee. After the 6 weeks are completed, the surgeon wants you to work directly on the knee to help with scar tissue, adhesions, and circulation. Would this be considered a local or a systemic contraindication? Very good. So if you said local contraindication, you are correct. For the first 6 weeks, we will need to avoid the incision because it is locally contraindicated. Now, after the 6 weeks are complete, the client is indicated for massage on the knee for scar tissue, adhesions, and circulation. So very good. Make sure you understand the difference between local and systemic contraindications. It is more than likely you will see these terms on the MBLEx. I would encourage you to dive into your textbooks and look up this information. There are numerous common causes of contraindications, such as inflammation, fever, acute infection, etc. So make sure you have an understanding of all these before you go into the MBLEx. Remember that client assessment and reassessment and treatment planning are 17% of the MBLEx, meaning that there is likely 17 out of 100 questions on materials like this. So make sure you know this stuff. As always, feel free to reach out to me with any questions about this material. My email is in the About Me section of this YouTube channel. Y'all have a wonderful week ahead, and I will see y'all in the next video. Y'all take care.